This is Hayden Slater, and he's 14 weeks old almost. He was 1 pound 7 ounces when he was born. It was really scary because like his skin just like hung like on his bone, and he really didn't move. Like it would be a lot for him to lift up his arm because he was so tiny.
The 100,000 Babies campaign is a quality improvement initiative for NICUs across the country to improve the quality of care for the babies we take care of. This is looking for the promise of electronic medical records and data warehouse information. It covers potentially about 20% of the neonatal intensive care units in this country. Before we start seeing patients, it's important every day to scrub in. And we have a 3-minute scrub. One of the best things we can do to reduce infection is continue to wash hands. It's simple, it's old-fashioned, but it works. So let's go look at a patient. We'll have a look at Hayden. Hi. I'm listening to his heart and his lungs. And I'm listening to his abdomen, and I'm watching how he behaves. I'm doing well. Okay, young man, we're going to let you be. And we're going to put some information in the computer. All of this information is collected by this program. And it allows us to do our daily note and at the same time collect information for a much broader look at what goes on and what our outcomes are. This is a huge data warehouse. It's got over 600,000 patients in it, over 12 million patient days. So it's been going on for a long time. It gives us a rich source of what's actually going on if we want to look at our center and we want to compare it to some other centers.
We identified 5 different areas that we thought needed work, one of them being decreasing the risk of central bloodstream infections that were related to catheter insertion. These infections are very dangerous for premature babies because they are immunosuppressed to begin with. Most of their infections are introduced through the skin. We cut open into that skin, or we break the integrity of the skin every time we put an IV in.
It's kind of scary when you see your child first come out and they have like the cannulas, they're like really red, they have IVs, and it's just a very scary experience, but the nurses here make you feel comfortable.
So with the central catheters, what we choose to do is avoid the continuous IV insertion because these catheters can stay in for weeks, even months if they're properly taken care of, without an infection.
Every one of these blood infections prevented, you save in costs about $10,000. So this makes economic sense as well as you want to save the patients from having bloodstream infections. Catheter-related bloodstream infection area, we've been able to reduce those infections by 36%. We had set for ourselves a 10% reduction goal. We've done better than that. We expect in the next 2 years to drive that rate lower.
The difference between this campaign and other campaigns is we're dealing with babies. That is a very emotional subject for everyone.
How compelling is that data?
It's too early to tell. We know what needs to happen in order to be successful with the 100,000 Babies campaign. But now we need a number of participants that is large enough to show and demonstrate the results that will truly signify a very successful venture, ongoing.
If you come out of a nice, warm, wet environment and step into the cold room of an operative delivery, it's the equivalent of an adult stepping outside naked in a 32-degree on a 32-degree day. To get the room temperature right, people who are doing the surgery have to be aware that that's important. So we had an education campaign. We had to find out who was going to have their hand on the control and get them to do this on a regular basis. They needed to know how warm it had to be.
The challenges, as with any campaign, are in the people who implement the campaign. We have to have buy-in from those individuals who are the healthcare professionals. If they're willing to buy into the campaign, if they're willing to commit themselves, the campaign will ultimately be a rousing success.
It's kind of scary the first time you leave your children, especially being a new mom, and not knowing what's going to happen or what you're going to do or how the babies are going to do, you know, being so early.
He's overcome a lot. He can listen to music now. Before we had to be very, very quiet in case he was in that deep sleep. Like, I know it's okay to leave him. He's gonna be okay. But it took me this long for him to be okay.